So last month, tons of creators, especially male creators, crushed watermelons between their legs to raise awareness about women's heart health. But you know something? I think that while that is hard, I think we can go harder. Because you know what's actually hard? Doing quality CPR. And that's what may actually save a woman's life. Did you know that one of the reasons that women often don't receive quality CPR is because of, forget him, he's a man anyway. These things right here, because of breasts. Too many people are afraid to actually perform CPR correctly on a female patient or a female victim because of breasts. How ridiculous is that? So we're gonna do 2 minutes of quality compressions and try to save her life. Okay? We want the heel of our palm in the middle of the sternum. If you use your thumb and come up and find the middle of the sternum or the breastbone, you can come up and place your hand right there. Yeah, guess what? You're gonna be grabbing some breast. That's okay. She wants to live. Okay? We're gonna get close to the body so that we can use our body weight to do these compressions. Okay? And we are just going to press away at about 2 to 2.5 inches of depth at a rate of about 100 and 120 beats per minute. When you do this, you are perfusing the tissue, meaning you're pumping blood and oxygen throughout the body, to the brain, to vital organs, and this drastically increases a person's chance of survival. Now, while you can do mouth to mouth, and if you're going to and do rescue breaths, you do that on a rate of 30 compressions to 2 breaths. Okay? Now, we don't always have to do that, and chest compressions are the best option. That is the most important thing to keep tissue perfusion going to the body and to the brain. So, let's talk about women's heart health. One of the reasons that women don't often receive the care that they deserve is because we don't know enough about, or too many people aren't trained in the way that they present. So, for example, when women present with a heart attack, often they don't present with what we would call male typical symptoms. You know, that crushing chest pain or radiating pain down the left arm. Often they present with things like nausea, back pain, jaw pain is a really common one. And this can create a lot of different issues because their symptoms aren't identified. Also, what can happen is they can be treated as if it's just anxiety, and then they're dismissed. They're sent home. They're told to go drink some water, things like that. So this can become an issue where women are dismissed, not treated, and then they get sent home. Meanwhile, they're having an MI. So it's important to not only be able to perform quality CPR, it's also important to be able to correctly identify when women may be having a cardiac emergency. So I hope that you stayed this whole time. I hope that you've learned something. And you know what? I promise you, doing 2 minutes of quality chest compressions is probably harder than pressing a watermelon. Or at least I choose to believe that. Love you.